Go.
Yes, sir.
Okay. Thank you, Denisha. And welcome to everyone this morning. And first off, I'll ask Denisha to call the roll of board members, please.
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Russell Crutchfield,
Here.
Roger Folsom,
Here.
Anthony Williamson,
Here.
Cynthia Rucker,
Here.
David Cruz,
Here.
Nelva Lee,
Here.
Shane Mobley,
Here.
and Robert Coles. Lexi just said it just came back up.
Mm-hmm. Yeah. Come on. Ooh, this thing lagging. It's lagging. Here we go. All right, we're ready.
Board members, are you able to hear me?
Yes.
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 Thank you.
Yes.
We can move forward, Chairman.
Okay, we can move back to the agenda. And hopefully that's the last interruption we have, and thanks you very much for your patience. On the agenda, we had moved to the approval of the minutes of the August 10 board meeting and ask if our secretary, Dr. Rucker, had a chance to review those minutes and can recommend approval.
Yes, sir, Mr. Boyd, Chairman Board. I have reviewed the minutes. I found them to be in order. I move the minutes be approved as stand.
Is there a second to that approval motion?
I second, Dr. Lee.
Dr. Lee has seconded that, and all in favor say aye.
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 Opposed? Abstaining? Hearing none, the August 10 minutes are approved. Next, we'll move to the August 24 meeting, which was the primarily the budget meeting. And ask again, our secretary, Dr. Ruckers, had a chance to review those minutes and can recommend approval.
Yes, I have reviewed those minutes and I do recommend approval as stands.
Thank you very much. Is there a second to that approval?
Second.
Shane, yep.
Think we just lost the room again.
And we hear ourselves, but not the room.
I believe that's correct.
Yes,
I can hear as well. It's Bob Coles. But I can't see.
right, me too.
In communications, it's gonna turn on closed captions for everyone, so they can make sure they're at least seeing the audio, even if they should be able to hear it, but they're gonna turn that feature on as well.
So you let me know when it's available, when it's on.
Board members, can you hear me?
Yes.
Yeah.
Okay, for everyone that did not get the note in the chat, we are removing the video feature and we are just using audio.
Okay.
Okay.
If everyone can hear, we'll move again, ask for a second on the approval of the minutes of the August 24 meeting. Is there a second of that approval recommendation?
Russell Crutchfield, the second.
There you go.
Yeah, the motion has been seconded. All in favor, say aye. Aye.
Aye.
Aye. Opposed?
Aye.
Abstaining? Motion carries. Thank you very much. The minutes are approved. The essence of covering, first of all, our most priority items here for the department's sake, we'll move to the two items on the agenda, the first two items that we'll be asked to vote on, which are approvals for final adoption. So I'll move to Melanie Simon, our general counsel, will present the item related to facility regulation, licensing, and enforcement requirements. So Melanie, please.
Good morning, Mr. Chairman, Commissioner, and members of the board. The Division of Healthcare Facility Regulation presents rules today for final adoption. These rules are found in Chapter 111.825 of the Department's Rules and Regulations, which pertain to general licensing and enforcement requirements. The rules reference the department's mandatory fines for nursing homes related to closure, change of ownership, or other material changes, and also set forth mandatory fines for hospitals and related institutions for violations of OCGA 31.7.3.5. An opportunity for public comment was held on August 23rd at 2 p.m. and written comments were due on or before August 30th. No oral or written comments were received by the department. Accordingly, we respectfully request consideration for final adoption today, and I am certainly happy to answer any questions.
Any questions, comments from the board for Melanie, please? Hearing none, is there a motion for approval for final adoption?
Roger Folsom, motion for final adoption, Mr. Chairman.
Roger Folsom made the motion for final adoption. Is there a second?
Shane Mobley, second.
Shane Mobley has seconded that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? It is approved, Melanie. Thank you very much.
Thank you.
With that, we'll bring on Brian Dowd, who Executive Director of Policy and Compliance in medical assistance plans, and he will have a presentation on the first item being considered for final adoption is rate methodology. So Brian, please.
Thank you, Mr. Chairman, Commissioner, and members of the board. First, I'm presenting for final adoption a proposed rate methodology change for current procedural terminology, or CPT codes 96112 and 96113. At the August board meeting, DCH proposed updating the payment methodology currently utilized for CPT codes 96112 and 96113 to 100% of the 2022 Medicare rate effective July 1st, 2023. The methodology would be calculated using the average 2022 Medicare non-facility price for the Metro Atlanta fee schedule. The CPT codes are used by physicians and physicians extenders for cognitive, developmental, and behavioral screening and testing. They're particularly important for physicians and physician extenders in diagnosing several conditions, particularly autism. An opportunity for public comment on the proposed changes was held on August 14th, 2023 at noon via Zoom audio. Written comments were allowed to be submitted on the proposed change on or before August 21st, 2023. There were no oral or written comments received by the department. If there are any questions, I'd be happy to answer them now and would respectfully request your final adoption of the rate methodology change for CPT codes 96112 and 96113.
Any questions, comments from the board, please? Hearing none, is there a motion for approval of final adoption?
Russell Crutchfield, motion to approve.
Russell Crutchfield has recommended final adoption. Is there a second?
Cynthia Rucker, second.
Dr. Ruckers has seconded that. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, and you have two other items on the agenda that will be considered for initial adoption. Please proceed with those two.
Thank you. Next, I am presenting for initial adoption a proposed rate methodology change for psychiatric residential treatment facilities, or PRTFs. Pending CMS approval and board approval, the Department of Community Health proposes to adjust the fee-for-service rates for psychiatric residential treatment facilities effective September 15th, 2023. Rates for all PRTFs will be adjusted to 75% of the 2022 Medicare inpatient facility rates. The rate will be both for the base rate and for children with a co-occurring diagnosis of autism, which we identify in the system with an AU modifier. The Georgia legislature funds the state match for PRTF services in the fee-for-service program through a budget allocation both to the Department of Community Health for the children who have the co-occurring diagnosis of autism, and for the children with just behavioral health conditions, that funding goes to the Department of Behavioral Health and Developmental Disabilities. The cost impact in state fiscal year 2024 to DBHDD is expected to be $400,290 in state funds and $809,776 in federal funds for a total funding impact of $1,210,000 and $210.66. Sorry. The cost impact for DCH for children with co-occurring diagnosis of autism is $100,072 in state funds and $202,444 in federal funds for a total cost impact of $302,516. An opportunity for public comment on the proposed change will be held on September 20th, 2023 at 11 o'clock a.m. via Zoom audio. Written comments may be submitted on the proposed change on or before September 27th, 2023. If there are any questions, I would be happy to ask them at this time and would respectfully request your initial adoption of the rate methodology change for PRTFs.
Any questions, comments from the board, please? Brian, I assume the funding that you're talking about is a part of the budget approved
Yes, it's approved in our allocated funding.
in your allocated funding, okay. This is
And
not- this is
DDHDD
not
is aware.
anything outside the budget that is being requested.
No, sir, absolutely not. And DBHDD has been with us throughout the process, just for clarity.
Okay. Is there a or is there a motion for approval for initial adoption?
Motion for approval, David Cruz.
Cruz has made the motion for approval. Is there a second?
Roger Folsom, second.
Roger Folsom is seconded. All in favor, say aye. Aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, you may move on.
Thank you, sir. Finally, I am presenting for initial adoption coverage of biomarker testing. Effective September 15th, 2023, pending DCH board approval, the Department of Community Health proposes to update the Medicaid and Peach Care for Kids coverage package to allow for biomarker testing. Biomarker testing is the analysis of a patient's tissue, blood, or other biospecimens for the presence of an indicator of normal biological processes, pathogenic processes, or pharmacological responses to a specific therapeutic intervention. Some examples may include gene mutations and known gene-drug interactions for medications. Initially, DCH plans on opening the current procedural terminology codes 0037U, 0239U, 017U, and 0345U for coverage. Other codes are currently being reviewed as well and may be included once the benefit is open. All biomarker testing codes will be priced at 80% of the third quarter 2023 clinical diagnostic laboratory fee schedule. The cost impact in state fiscal year 2024 to DCH is $199,194 in state funds and $448,064 in federal funds, for a total fund impact of $647,258. An opportunity for public comment on this proposed change will be held on September 21st, 2023 at 12:30 p.m. via Zoom audio. Written comments may be submitted on the proposed change on or before September 28th, 2023. If there are any questions, I'd be happy to answer them and request your initial adoption of coverage of biomarker testing.
Thank you, Brian. Are there questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Motion for approval for initial adoption, Cynthia Rucker.
Dr. Ruckers has made the motion for approval. Is there a second?
Second, Williamson.
Anthony Williamson has seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Thank you very much, Brian.
Thank you, sir.
Now we'll hear from Lynette Rhodes, Chief Health Policy Officer, and she has two items to present for consideration for initial adoption. And Lynette, you may proceed.
Thank you. Good morning, Chairman, Commissioner, and members of the board. As always, thank you for the opportunity to present. Pending approval from the Centers for Medicare and Medicaid Services and also the Department of Community Health's board, DCH proposes to establish certified community behavioral health center services effective July the 1st of 2024. Community behavioral health center services include a comprehensive and integrated package of mental health and substance use disorder treatment services and supports. This new service will help to improve access to community-based mental health services and will increase detection of mental health conditions. DCH will reimburse previously individually billed outpatient behavioral health services as a daily per diem. CCBHC providers will be required to be certified by the Georgia Department of Behavioral Health and Developmental Disabilities in accordance with state and federal law, policy, and the U.S. Department of Health and Human Services Substance Abuse and Mental Health Services Administration requirements. The state will reimburse CCBHC providers on a bundled payment basis using a provider-specific daily payment rate. The bundled payment represents the cost of providing all CCBHC services. A CCBHC service provider will receive payment for each day that services are provided to a Medicaid beneficiary. Payment will be limited to one payment per day, per CCBHC, per beneficiary for each visit. Thus, if an individual receives multiple services in one day, there will only be one single payment for that day. Initial rates will be developed based upon provider-specific
cost report data from state fiscal year 2022. The state will review CCBHC cost and expenses annually using the CMS CCBHC cost report. A list of all of the CCBHC services is included and outlined within the public notice. And this listing also includes health home coordination. The cost impact of this service is neutral. An opportunity for public comment will be held on September the 20th at 12:30 p.m. via Zoom. Written comments are due on or before September the 27th. I will pause now, Chairman, for any questions from the board.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Dr. Coles, so move.
Dr. Coles has moved for initial adoption approval. Is there a second?
Shane Mobley seconds.
Shane Mobley has seconded. All in favor, say aye.
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 Opposed? Abstaining?
Abstaining, David Cruz.
I'm sorry, David, did you make a
Abstain.
comment to abstain?
Yes.
Was that a yes?
Yes.
Let the minutes record that David Cruz has abstained from this vote. With that, it is approved for initial adoption with the count. You may proceed to your next area.
Thank you, Chairman. Pending approval from the Centers for Medicare and Medicaid Services and approval from the Department of Community Health's board, DCH proposes to amend the new options waiver and the comprehensive supports waiver effective November the 10th, 2023. Specifically, DCH proposes to sustain targeted rates within the waivers previously determined through an Appendix K, which will expire on November the 11th of 2023. The proposed rate increases will be initially funded through the American Rescue Plan Act funding. Following exhaustion of the American Rescue Plan Act funds, the state match for the rate increases will be financed through the Department of Behavioral Health and Developmental Disabilities. The proposed rate increases are outlined within the public notice. The specific services that will be impacted include support coordination, community living support services, community residential alternative services, community access group, community access individual, nursing services, and financial support services for self-directed. The new options waiver individual cost limit will increase to $47,124. The total fiscal impact of this change for state fiscal year 24 is $53.3 million. That represents total funds. Of the total funds, 35.1 million represent federal funds and 18.2 million represent state funds. Additionally, the department proposes to modify both waivers to allow for the Appendix K provision continuing family caregiver hire for legally responsible persons, relatives, and legal guardians for community access, community living supports, supported employment services, and transportation services. Public guardians cannot serve as family caregivers for hire. Additionally, legally responsible persons may only provide these services when they constitute care over and above that which a legally responsible person would ordinarily provide. An opportunity for public comment will be held on September the 21st, 2023 at 11 a.m. via Zoom. Written comments are due on or before October the 16th. I will pause now, Chairman, for any questions from the board.
Any questions, comments from the board for Lynette, please? Hearing none, is there a motion for approval for initial adoption?
Mr. Chairman,
Yes,
this is Bob Coles.
yes, Dr. Cole,
do
please
have a-
proceed.
I do have a question. This apparently is not replacing anything. This is an add-on expenditure, correct?
Correct. So if you recall, under the, or during the public health emergency, we submitted what were called Appendix K authorities that allowed us to implement rate increases. And so those are set to expire 6 months after the end of the public health emergency, which ended on May the 11th. So to your point, in order to continue these, we now have to amend the waiver so that they're now permanent going forward.
So unfortunately, that leads to another question. So then if the pandemic started this and the pandemic is over, why are we spending millions, many millions of dollars on something that we didn't deem necessary prior to the pandemic?
So I think there are a couple of responses to that. So first and foremost, I think everyone is aware of the challenges that we're experiencing with workforce shortages. So this helps to maintain and establish some type of consistency going forward. So this will assist those providers in maintaining staff and hopefully continuing those services ongoing. And then just the overall additional cost of providing those services. So it is needed going forward, but that's part of the reason why we're sustaining these and keeping these in place.
And those services are mostly mental health?
Correct. These are our behavioral health waivers, both the NOW and the COMP. So these are administered by DBHDD. They're owned by DCH, but the actual waivers are administered and operated daily by DBHDD.
And does this apply to citizens of the United States only?
It's those individuals who would normally qualify for Medicaid services under these two waivers.
My concern simply is that that's a lot of money to spend on mental health that apparently we didn't spend before we got into the state of emergency during the pandemic. And I'm just trying to get my arms around what has changed the landscape of mental health so dramatically as to require so many millions of dollars to continue to treat.
Sure. So I'll start off by saying, and I'm sure the members of the board are well aware of this, within the state of Georgia, there has been a significant focus over the past years on behavioral health service and access to behavioral health services. And there has been mounting pressure to find ways in which to increase access to those services. And during the public health emergency, what we found in Georgia, and not only Georgia, but nationwide, is that in order to ensure that we were able to continue to provide those services, we had to implement these rate increases to help, number one, stabilize the workforce. And so, that is something that we continue to focus on moving forward. And although the public health emergency has ended, keep in mind that that lasted for approximately 3 years. So the public health emergency started in March of 2020, and we have been trying to find ways in which to better navigate our behavioral health services in Georgia and ways in which to increase access really during that time. So that is why this will serve that purpose going forward.
Thank you very much.
Thank you.
Mr. Chairman,
Other questions or comments for Lynette, please?
Mr. Chairman, David Cruz, I just wanted to clarify that this funding is for individuals with developmental disabilities. Is that not correct?
That's correct. This funding is for the individuals who will be served through these two waivers, the new options waiver and the comprehensive supports waiver. So you're correct. That is the population that's served under these waivers for these specific services that are outlined.
Thank you.
Other questions, comments? Is there a motion for approval for initial adoption?
Motion for approval, Cynthia Rucker.
Dr. Rucker, I believe you said you made the motion for approval. Is that correct?
Yes, sir.
Is there a second?
I second Dr. Lee.
Dr. Lee has seconded that. All in favor of initial adoption approval, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Thank you very much, Lynette.
Thank you.
The last item for consideration for vote today will be presented by Kim Morris on medical assistance plans, and it will be for initial adoption consideration.
Good morning, Chairman Board, members of the board, and Commissioner Carlson. Today, I am presenting for initial adoption pending Medicare and Medicaid services acceptance and approval from the DCH Board, a proposal to change from the TRICARE Diagnostic Related Group, which is called DRGs, to the All Patient Refined APR Diagnostic Related Group, or effective January 1st, 2024. The cost impact of this change is budget neutral, resulting in no additional federal or state dollars. While there is no overall budget increase, there may be fiscal impact to the individual hospitals. To mitigate the fiscal impact to the individual hospitals, DCH would include a stop-gain, stop-loss factor. Currently, the department is reimbursing inpatient hospital stays using the TRICARE DRG grouper. The TRICARE DRG was developed for the Department of Defense and adapted for Medicare and Medicaid hospital reimbursement. Georgia is the only state still using the TRICARE DRG grouper to reimburse hospitals for inpatient hospital stays. 31 other state Medicaid agencies are using APR DRG to calculate their state's Medicaid payment for the inpatient hospital stay. APR DRG is applicable to all patient populations, including obstetrics, newborns, and pediatrics. How would this change impact payments to the state's inpatient hospitals? The only change to hospital reimbursement methodology is the change of the grouper. The change of the grouper will impact the DRG weights assigned to each DRG code. The DRG is a classification system that groups similar clinical conditions, diagnoses, and procedures delivered by the hospital during a patient's stay. Under APR DRG, the hospital statewide base rate would change from $5,310.99 to $5,985.86. The statewide base rate average was last updated in 2019. The department will continue to include the 4 components that can change the statewide base rate to the hospital-specific base rate. So we start off with the statewide base rate, and these 4 components then individualize it to the hospitals. The 4 components for pediatric specialty hospitals, they receive an add-on of $3,400 per admission, and we have 3 pediatric hospitals. We also have an add-on for Medicaid inpatient utilization rate. That's an add-on for hospitals whose Medicaid utilization is 11% or higher, and that's a tiered rate increase. We also have an add-on for hospitals that have graduate medical education programs. And last, we also have what's called the stop gain, stop loss. And what that does is it mitigates the impact of any IPPS rate changes on the hospitals. The formula for the hospital base rate payments will remain the same. That formula is the base rate payment is equal to the DRG weight times the hospital-specific base rate. Changing to the APR DRG rate will expand the number of DRG codes from 761 codes to 1,322 DRG codes. The additional DRG codes will provide greater severity of illness classifications for each patient's clinical condition. Each DRG has a payment weight assigned to it that calculates the average cost to treat patients. The DRG specific payment weight is applied to a hospital-specific base rate to determine payment. The department had 2 meetings with the hospitals regarding the transition from TRICARE DRG to APR DRG. The first meeting was held on June 6, 2022, and that included a presentation from Myers and Stauffer's. This meeting was to notify the hospitals of the department's intent to transition to APR DRG. The second meeting was held on August 24th, 2023, and included a detailed presentation from Myers and Stauffer's and 3M. The inpatient hospitals, Medicaid managed care organizations, and Georgia Hospital Associations were invited to the meeting. Included in your package is a copy of the August 24th PowerPoint presentation that was presented to the hospitals and placed on the DCH website. An opportunity for public comments will be held on September 18, 2023 at 1 p.m. via Zoom audio. Written comments are due on or before September the 25th, 2023. At this time, I will answer any questions from the board and respectfully request approval to the board for initial adoption.
Mr. Chairman, I just wanted to commend him and her team on the outreach side of this, in addition to all the work that goes on that. They didn't make these decisions in a vacuum and really took into account the valuable input of the stakeholders. So thank you for taking all those extra steps.
Thank you.
Thanks for your comment, Commissioner. Any comments or questions from the board, please? Hearing none, is there a motion for approval for initial adoption?
Roger Folsom, motion for initial adoption, Mr. Chairman.
Roger Folsom has made the motion for approval. Is there a second?
David Cruz seconds.
David Cruz has seconded that. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, thank you so very much, and we'll look forward to your input from the initial adoption approval and when you bring it back with any changes.
Thank you very much.
With that, that concludes the items that we're asking to consider today for vote. I'd like to return to the areas on the agenda that we skipped over to begin with and ask that David Cruz give a report from the audit committee meeting that was held earlier this morning. David, please.
Yes, thank you, Mr. Chairman. The audit committee met this morning and heard an update from the Inspector General, Sonia Allen Smith. One of the first things that was shared with the audit committee is that David Chong from the Department of Audits has been hired by DCH to head up internal audits for the department. And he's a great asset to be added to our team. So we welcome David This morning, Sonia Allen Smith gave a report that there are two reviews that are ongoing by CMS. One is a focus program integrity review, and the other is a Georgia Recovery Audit Contractor Review. She also reported that the Department of Audits and Accounts has two audits that are ongoing in addition to the statewide single audit. They are the statewide DOAA contract and procurement audit and a Department of Audit Medicaid Peach Care Program Integrity Audit. Those two reviews and two audits are ongoing in addition to the annual statewide single audit. In regard to the statewide single audit, for the year ended 2022, she gave an update on the findings and the progress with addressing the findings. And she reported that most all of the findings will be resolved in this calendar year. There may be one that carries over as a result of waiting on CMS approval in the process. But she gave a report of satisfactory progress is being made on the 2022 findings. And that was the end of my report, Mr. Chairman.
Thank you, David. Any questions for David or comments regarding the audit committee report? Hearing none, thank you for that. And I'll now turn it over to Commissioner Carlson for his report.
Thank you, Mr. Chairman, members of the committee, and all of you joining us virtually. In the interest of time, I'll forego my full remarks, but I will just, I would like to thank everyone on the agenda today for their work, not only today, but obviously the work that got us up to this point, and for those with initial adoption. I know there's plenty of work ahead, but I'd like to point out, though, that it wasn't just a full agenda. It was a very substantive agenda when you think about the content of these initiatives, whether they be the diagnosis of autism, psychiatric care, behavioral care, which continues to be an emphasis for our state, from both of our members, our citizens, but also the governor and the legislature. And much of this on the agenda was a very collaborative effort between the governor's office, our sister agencies, and stakeholders, providers. Much of this is, as we say here, braided, a lot of different funding streams, a lot of different initiatives, and it takes a lot of collaboration and goodwill between all of our partners to get these things onto the agenda and moved out to the field. So I want to thank the spirit of cooperation and collaboration, and I'm proud to be a part of this team, and thank you for joining us virtually here in our new boardroom. We hope to host many of you in person in the near future. But Mr. Chairman, out of the interest of time, I'll hand it back to you.
Thank you. Any questions, comments for Commissioner, please? Hearing none, I'd like to also say that we recognize the work that your staff, and thank them for the work they put in on these, as you say, very substantive issues there, and particularly for providing the materials through to our board members in advance, so that we can consider and have an opportunity to review before the presentations, and that's always very much appreciated. With that, is there anyone know of any new business that needs to come before the board at this time? Hearing none, the meeting is adjourned, and our next meeting will be back at this location on October the 12th. Thank you very much.
Thank you.
Thank you.